Hey guys, so my name is Ellie and I'm the lead educator with Ellie's Beauty Academy. So today we're going to go through some skin analysis as well as some skin consultations, okay? So let me just share my screen and just going to go ahead and first one we want to go over is going to be our skin health questionnaire. This is by Glymed. So once you create your student portal with Glymed, you'll be able to have access to this. It will be in the resources tab. And so just to kind of go through this with you quickly, of course, we want to get the client's information. This is also going to be kind of a liability waiver. So once the client kind of signs and dates it, if something were to happen in this treatment, you pretty much are covered because you'll have your own liability insurance, but also it'll state on here that, they know that something could happen or that they're taking a risk or that they're getting a treatment done and they're aware that there could be complications or there could be a reaction or maybe they have an acne breakout. So this is really to kind of cover your behinds, if you would. But it's also to give us a better idea of what the client's lifestyle is actually like. Okay. So on here, of course, we want to get their name. We want to get the date of the service. A phone number is great to have. I like to have their address because I like to send them in the mail something for their birthday month, maybe 10% off, or hey, bring a friend, you get buy one, get one, free, whatever the promotion might be that you're running. Maybe you want to run something special for their birthday month. And then email is always great to have as well so that you can send out any kind of promotions that you're running that way. An emergency contact would be great to have in case maybe the client passes out. You have someone that you can call besides 911. Um, Also, if they're underneath a physician's care, it's good for them to put their physician's name down, whether it's a dermatologist or maybe it's just their primary doctor. You can also put that down too. And then it's nice to know how they heard about you. Did they get referred? Did they find you on Google, social media? Maybe they found you on Groupon if you're on there. So, and then what their occupation is like. We want to kind of have a backstory, maybe they work at a desk. And so we know that they're sitting for long periods of time. We know that they're using their hands. We know that maybe they're on the phones a lot. So maybe they're going to be a good upgrade for massage therapy or maybe some kind of hand massage, wrist massage, a shoulder massage, scalp massage. Maybe we use some essential oils to really get them to kind of unwind and relax. Another example for occupation might be if they work outside. It's important to know, do they wear SPF? Is that why they're experiencing some pigmentation issues? So those are two examples of why we would want to know what occupation they actually do have. Um, Scrolling down a little bit, it's going to say on here the interest. What is the client interested in? Why do they want this visit today? Okay, why did they come in? Do they just want some skincare advice? Do they want to help manage their age? Maybe they want to manage their acne. Maybe they have sensitive skin. And then what's one thing that they would like to change about their skin? Okay. And always remember that the client will have some kind of high expectation. Don't over deliver with promises or over expectations because realistically, it's going to take a couple treatments or a series of treatments to really see a change in that client's skin. Okay. So we don't want to set them up to say, hey, you're going to see immediate results because yes, you will see a little bit slightly, but you're not going to see a drastic change if it's something specific that you're trying to treat with just one treatment. Okay. Scrolling on down, there is medical history. This is good to know. Anything that they have as far as maybe a pacemaker. Well, we know that's a metal implant in the body. And so we would not want to do any kind of electrical devices on them. Or maybe like herpes simplex. maybe we're going to do a Brazilian wax on them or a lip wax. Simply, we would want to know because anything that you do to the skin, if they do have herpes or they are prone to getting maybe cold sores, can create an outbreak. Okay. So they can just call their physician, and the physician will normally give them some kind of antiviral drug for the treatment. So they'll take it 24 hours before the treatment and 24 hours after the treatment. So it's just kind of important to kind of understand that as well. And verbally, we cannot ask the client, hey, do you have herpes? Or hey, do you have AIDS? You can't legally verbally ask that because we're not a doctor. But if it's on paper, it's free game. So you can really kind of adjust and put questions on here that you want that you feel might be important to know for whatever treatment you are getting ready to do on that client. And then if they're experiencing any kind of health-related conditions, to describe that, any surgeries, surgical or non-surgical, any allergies that they might have, certain allergies, meaning like aspirin, or bees. Wax usually is made of some kind of beeswax. Aspirin is a cousin to salicylic acid, which is in a lot of skincare products. So these are just kind of things that we want to try to understand. And if they do have any kind of allergies, maybe to essential oils, we know not to use them in the treatment. And then any kind of over-the-counter prescription medications that they're taking. Okay. Any kind of medications that they've taken before that are listed below here. So like Accutane, Retinol A, benzoyl peroxide, a lot of these fall into the vitamin A family, which are all resurfacing. So anytime you resurface the skin, it's going to make it a little bit more thinner. It's going to make it a little bit more sensitized. So it's contraindicated for a waxing service or exfoliation, any kind of chemical peels, because those medications are already kind of resurfacing that skin. Okay. And then um, if they're pregnant, you would want to know, as well as if they're trying to become pregnant. You want to know because if they're trying to become pregnant, they might already be pregnant and they don't know yet. So any kind of like chemical peels or any kind of electrical modalities, we would want to omit out of that service. Okay. Any kind of hormone therapy that they're on, any kind of irregular periods, hormone imbalances that they know of, any kind of hysterectomies that might have been performed. These are all going to fall into the category of hormones with women specifically, and that's going to help us to understand maybe something that's going on with their skin. If a woman's going through menopause, hormones play a huge part in what's going on. Their skin might be a little bit more drier than normal, right? So these are things we're going to talk about with the skin analysis, of course. So it's just kind of good to understand kind of hormonally what's going on with the client as well. And then skin care self-analysis. So this is just kind of asking, what is their daily routine like when it comes to skincare? Do they use an SPF? Don't they use an SPF? Do they wear moisturizer? Do they cleanse their skin? Do they exfoliate their skin? How often do they exfoliate? So this is for them to kind of fill out and for us to understand. And then the last on this is going to be the lifestyle and stress. How much water do they drink? How much coffee do they drink? Or if they are a tea drinker, so that would be caffeine. How much caffeine is the client actually taking in on a daily basis? Do they exercise? How much sleep do they get? What is their stress level like? What's their backstory, basically? What's their lifestyle? Are they really stressed? Maybe that's why they're having some breakouts at the moment. And so after we kind of go through these questions with them, it will help us to understand how to navigate the best treatment for that client. Okay. And then it says here, I understand and agree that they're ultimately responsible for the payment in full for the service that's received. The signature of the client, and then if it's a minor, you would have the guardian actually sign it. So you can customize this to however you want. You could create one on canva.com. You could make one on Etsy. Purchase one from Etsy. You can look up ideas on Google, or you can simply just create your own. And I would definitely put on there that they understand that they are, having this treatment done by a licensed professional, and that maybe they'll have some kind of potential reaction, maybe an outbreak could happen, just kind of letting them know, almost like a disclaimer that things can happen, but normally they don't, but it could. And so when they sign it and then they date it, that's the most important part of this whole form, okay? So moving on to the next form. So this was actually the health questionnaire. I would have them do this maybe once every 6 months to update, but you're going to file this and keep it. And so you can look at that for their next appointment and to pull it out quick. And then you can re-ask like, hey, are you still seeing a dermatologist? Or hey, are you still on this medication? And then kind of update it from there if you need. But once every 6 months is really good to kind of have them redo that. The next form is going to be the updated client treatment record. Okay, so this is also by Glymed Plus. And then this is a professional treatment consent form. Okay, so the client's name, any changes since the last visit. And again, you could also just have them do this. So use the skin health once every 6 months to have them fill out. So twice a year. And then every single treatment, they fill this form out. So this will have if their address changed, if the health has changed, any skincare products have changed, any medications, hormones, anything like that has changed, they can put it right here. And then it's going to ask, in the last 5 days, have they had any kind of waxing done to the face? Have they had any kind of excessive exposure to the sun? Been in a tanning bed? Have they been sick or feeling under the weather? Had any kind of surgical or aesthetic procedure done? Okay. In the last 24 hours, have they exercised, used retinol A, or had any kind of unusual stress? What's the plans for the rest of the day? If they say, hey, I'm going to the beach or I'm going to the Bahamas for the next 7 days. Well, we know we're not going to do any kind of dermaplaning. We're not going to do microneedling. We're not going to do any kind of chemical peels on them, okay? Because they're going to have a reaction to that. You need to have some kind of downtime, and going to the beach is not going to be advisable, okay? And then what's the plans for the next 7 days? Really what we're looking for is the yeses. If they put yes to any of these, that's going to be like a red flag. It's going to be the, hey, stop what you're doing. Let me reassess. Let me go over this and let me have a little bit more of an in-depth conversation with that client. Okay. If it's no, sometimes I still reiterate with the client because sometimes when we fill out paperwork, we don't read everything thoroughly and we just kind of check off what we think needs to be checked off, right? So it's important to kind of go back through and just reiterate with your client and say, hey, so I know that you said that you haven't had any kind of waxing done on your face. Have you had any kind of surgical anything in the last, 6 weeks? Okay, great. Whatever the situation might be, always kind of re-emphasize with them on the questions. Okay. And then most important part, again, is going to be the signature and the date. Okay. This is just going to give them some, this is really for you as the therapist to kind of put down maybe something that you used on them. And then maybe when their next appointment is, or what home care treatment you recommend for them. And then they can take a copy of this as well. Okay, so that's going to be the updated client treatment record form. And most of the time, these are digital. So you could digitally email this to the client or digitally DocuSign it to them so that they can fill this out and have it before you actually get the client in there and find, hey, they're contraindicated and can't get the service done. Okay. So with that, we're going to move on to, this is a skin analysis form. Okay, so this is by Dermalogica. This is called face mapping. These are really broken down into zones. And I want to see if I could open this. I bet you I can because I saved it. Let me go to my Adobe. And let me see if I can make this bigger. Okay. So on here, you can see that there's a little key, and this says, breakout activity, any kind of sensitivity or redness, oiliness, dehydration, milia, pigmentation, fine lines, comedones, or deep lines. Okay. And so in the face mapping here, we have this actually broken down into zones. So they used to do 14 zones and now they've kind of switched it. And I believe it's 6 zones now. So it makes it a little bit faster for you, but it's not as thorough. So your forehead's going to be kind of zone 1. And on here, let me just get my little, so I can draw. There we go. Okay, and I want to draw in the color red so you guys can see it, and I want to make it kind of thick. Okay, so we're going to say that this is zone 1, and then this would be zone 2, and this is 3, and then this would be 4, and then, I'm sorry, 4. Let me take that away. Okay, 1, 2. Other side of the cheek is 3. Come on the nose is 4. Below the lip is 5. And the décolleté neck is 6. I know the numbers look a little wonky. Let me make it a little thinner. Okay. So when we are checking, we're looking at zones 1. We come down onto the cheek. We have zone 2. We have other side of the cheek is 3. Nose is 4. Below the lip on the chin here is 5, and then neck and décolleté is going to be 6. Okay. And in here, we are looking, first of all, let me take these away now. We are looking in the T-zone. And the T-zone where that can be found is across the forehead and down the nose through the lip. And it forms the letter T. Okay, so this is your T-zone. And so we're just kind of looking specific area. This is where we're going to kind of look first. And what are we looking at first? I want to look at the size of the pores. Are they large or are they small? Okay. And I'm going to put this off the side here so you can see that if they are large pores, this is going to equal oily skin. Okay. If it is small pores, this is going to equal dry skin. Okay. So the larger you see it, the more oily, and the smaller, or if you really don't see it at all, it's going to be more dry skin. Sometimes it can be normal in appearance, but I'll show you exactly how you'll determine if it's normal. Okay. So going back to my drawing here, in the T-zone, we want to look first the forehead and the nose, above the lip, below the lip and the chin. If it's visible, that is going to be a true oily skin, okay? And so that would always be first listed. If it is small in appearance or you really don't see it at all, it could possibly be dry, and that would be listed first, okay? And now, once you determine what you see in that T-zone, you're going to look at the cheeks. So zones 2 and 3. Okay. And when you're looking at the cheeks, do you see it large in appearance? Or do you see it small? If you see it large and you saw it in the T-zone as large, that skin is a true oily skin type. Okay. If it is the other way, where it was small in the T-zone and small on the cheeks, it's a drier skin type, or maybe it's more of a normal appearance, okay, if you really don't see it at all. If it feels really hydrated, if it has great elasticity, meaning you pinch the skin and it kind of bounces back to its normal shape, these are all going to be cues that it's a normal, healthy skin. And so your objective for that treatment is going to be mainly to just kind of maintain what the client's doing or what they've got going on. If the T-zone was oily, right? We saw larger appearance, and so we know that's oily, but the cheeks were smaller, that could be a combination skin, okay? A combination is where you have both oily and dry kind of going on. Sensitive skin, dehydrated skin, acne, these are all going to be skin conditions. Acne is not a skin type. Sensitive is not a skin type. They are conditions, okay? Dehydration is a condition. There are 4 types of skin, okay? And so we already have oily, we have dry. The next one that we're gonna put here, we know is normal skin. And then we have combination skin, okay? So those are going to be oily skin, dry skin, normal skin, or combination skin. Okay, so remember, we're looking in the T-zone first. Once we determine what the appearance is in the T-zone, then we're going to go to the cheeks and look there. Once we determine what the skin type actually is, now we're going to go down into this key and we're going to start seeing what the conditions are or what's going on with the skin. So let me make this a little smaller and let me get a different color. Let's just do purple because it's cool. And let's say that you see maybe a lot of breakouts. Maybe the client's got a lot of acne going on, right? And it's everywhere, okay? Well, instead of they're recommending that you put the letter B for breakout. Instead of putting a B, I can do this with my hand actually, a B, a B, a B. What's best to actually do is going to be putting maybe the letter B and then drawing an arrow around the face. Oops. Okay, come on now. Okay, let me go back to my arrow here. Okay, so the arrow around is going to indicate B for breakout, right? And the arrow, it's around the whole majority of the face, okay? Now, maybe you saw it only on maybe the nose area, okay? Maybe you saw it here. You can just put a little breakout there so you'll know. Maybe you saw one here on the cheek. That's fine to do it that way as well. Now, let's say they've got dehydration. And most of the time, dehydration could be underneath the eyes or the forehead, or it's the whole face. So again, if it's the whole face, we're just going to do D, and then we're going to do an H, and we're going to draw an arrow around, indicating that the whole skin is dehydrated, okay? And keep in mind when you're looking at this paper, it will actually be upside down for you to look and mirror exactly how the client looks while they're laying on your table when you're doing this, okay? So that would be your indication for dehydration, okay? Let's say that they've got some pigmentation. You can put a P for pigmentation, okay? Maybe it's on, you know, the left side more than the right. That could indicate that maybe they drive a lot, or maybe they're a passenger, or maybe that's the side that they sleep on more. So you can put P for pigmentation. A comedone is the scientific term for a blackhead or a whitehead. Okay, so a C for comedone usually is on this T-zone area. So you can just put a couple C's, or maybe that maybe you see it down in the chin area a lot. You could just draw a C and then draw an arrow in that specific area. Okay, so that kind of gives you that better indication. Okay, so this is how you would perform a skin analysis, and it's really important to not just look, but also to feel what's going on with the skin. And I will put another little video that kind of shows a woman with dermatologica and how she actually performs a skin analysis really quickly on a client, so that you can kind of see what I'm talking about kind of in action as well. And if you guys have any other questions, just let me know. And so the next video that we're going to go into is actually how to greet your client when they walk in, and then also talking about the contraindications of certain treatments, so that way you have a better understanding of maybe what treatment you would not do on a client, okay? So let me stop sharing my screen with you guys, and thank you so much, and I hope you guys have a wonderful day, and we'll see you in the next one. Bye, guys.